Hello, Dr. Shahani Amjah, and thank you so much for joining us on another episode of Beyond the White Coat series. You have been practicing medicine as a GP in Sri Lanka and Hong Kong over 3 years now. And I know that you have a special interest in not just treating women and children, but also educating women on preterm labor, preterm births, and also telling them what life is about. This is a very important global issue that we're now facing. If you see the WHO statistics in 2020, about 13.4 million preterm births were recorded, of which over a million babies didn't survive. So I can understand the reason why you're here. And I also know that you have a personal reason. So, what inspired you to take up this subject and raise awareness on this?
Yes, preterm labor, preterm birth, and premature babies are very close to my heart because I had experience of having a preterm delivery myself. I went into preterm labor. Despite being a medical practitioner, I faced a lot of difficulties, and I did not expect that, despite having that much support for me from my family, from my staff. I still had a difficult time, and I didn't want that for any other mother or any other baby. And that is why I am so passionate about it means so much to me to actually talk about this, make women aware about this, and hopefully help these mothers and babies to achieve the optimal health outcomes that is possible for them.
Call
So,
this fate, call this coincidence. I've mentioned this to you earlier, and I've not refrained or shied away from saying this to others on my social media that I've had a preterm birth myself at 22 weeks about 10 years ago. And to this day, even after we had another baby after that, and he's about 9 years old now, to this day I wonder why, what happened that day, because I clearly, it was, even though it was a second pregnancy, I didn't see the signs. I didn't know anything about preterm labor. I had a normal first delivery. I went into about 37 weeks during my pregnancy. I could never imagine that anyone could have a preterm labor at 22 weeks. So when the signs came, I thought it was just gastric problems, stomach pain. It never occurred to me that it could be signs of labor. And I waited for 2 hours at home before I could rush to the hospital to realize that it was not something that I expected. So, what do you say are the signs that people can look out for so that nobody ever has to go through something like this?
yes, so to be honest, when we talk about preterm deliveries, it can happen spontaneously, right? Which is what we call preterm labor. But then there are some instances if the baby is in risk or the mother is in risk due to some medical condition, we as medical practitioners have to take the baby out or deliver prematurely. So that is a different topic for a different day. But then today, I want to specifically talk about preterm labor. When you go into spontaneous labor, and this can happen between 20 to 37 weeks because usually pregnancy lasts for around 40 to 42 weeks, and women deliver between 37 to 40 to 42 weeks. But there are times when women can go into spontaneous labor between the time 20 to 37 weeks, and this we call preterm labor. So there are certain risk factors or there are certain reasons as to why women can go into labor sooner, and these can be their lifestyle choices, like if they are smoking, if they are having any alcohol, or if they are drinking, or if they are having any um, illicit drugs, that can have a risk of going into preterm labor. Then there are certain medical conditions, like if you have high blood pressure, or if your sugar levels are abnormal, if you have some conditions, abnormality in your uterus or your placenta, that also can lead to preterm labor. And another thing is if you have multiple babies, like if you're carrying twins, triplets, this is also another reason where you can go into labor earlier. And apart from these, if it's a teenage pregnancy, or what we call, if your pregnancies are too close to each other, like sometimes less than 6 months apart, you can go into preterm labor. So these are like a very few. And if you have a past history, or your family has a history of going into preterm labor, then you can go into preterm labor. So one of the important things is, before you go into preterm labor, if you know that, okay, so you have to, yes, your obstetricians or your midwives may ask for these things at your visits, but sometimes it can be missed. But then you should be aware of this, and you should let them know, okay, I have this, or this has happened to me before. Is there a risk of me having the baby earlier? Because if you are at risk, then there are certain things we do, certain things that are monitored, so that we can prevent those. We can make certain lifestyle changes, we can do these investigations, because even something simple as stress can induce preterm labor because of the hormones and the cortisol during when we are very stressed, right? This can have an effect on our cervix, and then of course then induce labor, which can happen earlier than intended. So these factors are important that we prevent it from happening. And so, how do we know that? Okay, so we feel like a back pain or a stomach ache. How do we know it's not just a contraction and it is actual labor? Usually, you will feel like period cramps, but you'll also feel your stomach actually tightening. So, you can feel it. You can keep your hands on your tummy and see if it's tightening. And the other thing is, with labor, these so called contractions will come and go, come and go. And another thing is that you will count how many contractions. Like if you say during the time of like 20 minutes, it's more than four. During an hour, if you're having around eight of, then it is concerning. Then you have to go to hospital. if the if your abdominal pain or your back pain is associated with some sort of bleeding or like brownish discharge, right, you call it like the mucoid plug. So that means your cervix is beginning to open up, or the place where the baby is coming is beginning to open up. So these additional things that you might see or feel, if you feel like a gush of fluid, sometimes people might think, did I pass urine? Don't take the risk. If you have any doubt of if you passed any fluid, if there is any bleeding or any discharge, if it is accompanied by any abdominal pain, if you feel any reduction of your fetal movements comparatively to before, these are all red flags. These are all signs that you should immediately go to the doctor, immediately go to hospital, or ask somebody, okay, I'm something like this is happening. What do you think I should do? You have to take immediate action because time is precious. The sooner we intervene, the better result we can have. And yeah, so that is one of the most things I would say. If you are having continuous pains coming and going like the numbers, within 20 minutes around 4, within an hour around 8, is there any discharge, bloody discharge, any watery discharge, a- any change in the movement of the baby? All this is concerning, and you have to figure out why. And one of the things I would tell mothers is, when you're going to hospital, go to hospital immediately, and also make sure you go um, without eating or drinking anything. In case of an emergency, then we can intervene quickly.
Yeah, I do understand that time is of essence. A few minutes, a few hours could make a huge difference, like it did in my case. And I just couldn't see the signs, uh, especially because no one tells us about the worst cases, right? Everybody talks to us about dragging it to 40 weeks and how tired you are at 38 weeks and you're waiting, and if it's usually the first baby, they're never going to come early, they're always going to be. These are all the myths that are associated with pregnancy. And no one really prepares you for the worst case scenario. You don't, expectant mothers don't want to read things that might look like anything related to preterm births, because we don't want to associate ourselves with it, right? So it might also be that as an expectant mother, just like how we would read what to expect when you're expecting, I think we should also read about what to expect if something like this happens. If you go into preterm labor, if this happens, what should you do? How quickly should you go to your doctor? How quickly should you reach your hospital? And what are the signs to look out for? Like you said, the discharge may not look like it's significant, right? It might just look like a brownish discharge, which doesn't cause any concern. But you are saying that could also be a sign of concern if that is compiled with stomach pain or back pain, or you feel like you're having contractions. These are the times you should rush immediately to a hospital, and nobody ever prepares you for that moment because everything is in a rush. You don't know what's happening with you. So definitely signs to look out for, like you said. Yeah, so are there any proactive measures people can take, do you think, if in case they want to prevent it in future? Are there any measures?
Yes, one of the main thing is, if you know that okay, you are a smoker, you're around a smoker, you're drinking alcohol, it is always the best to quit if you're planning for a pregnancy. And if you're already had a baby, it's always better to get the sort of a contraception method, or to plan the next pregnancy, to have a healthy gap between the pregnancies, because it is good for you, it is good for your babies when it comes to nutrition, and when it comes to actually bond and caring and all these things, because that is also one of the factors that can cause preterm labor. So make sure your medical conditions are under control. And if you are pregnant with multiple babies, like twins or triplets, make sure you're going to those visits regularly. It's much more, the frequency we go to the obstetrician is more when we are pregnant with multiple babies. So these are things that we can look out for. Know your risk factors, know that it can happen and it can be prevented by making these small changes. And know the signs and symptoms so that you can actually take quick steps so that it helps and it aids in optimal health outcomes.
Yeah, and what would you tell parents or would-be parents who are anxious about preterm labor? If they've if they've heard about an incident like this, or somebody in the family might have had a preterm labor, so if somebody is really anxious about it, is there any steps that they can take to get rid of this anxiety?
So the first thing is, being anxious is a natural thing. If you're scared, if you're anxious, it's okay. It's okay, but talk to someone about it. If you talk to someone about it, share this anxiety, then they can help you relieve that anxiety. And one of the things is, now medicine is really advanced. We have, like, that's why 20 to 37 weeks. Those days it used to be 28 weeks, then we brought it down to 24 weeks, now it is 20 weeks, because now even at that age babies can survive. So medical practitioners now, the NICUs, the PBUs, they are like very well equipped, they are highly trained to take care of these babies. Even if something like this happens, if you go on time, there are things that we do. First, we confirm whether it is actually a preterm labor. Then, if it is, we give certain medicine that will, or we give certain treatment that will help the baby's lungs grow, lungs mature. We try to pause the contractions if possible by giving certain things that will help reduce the contractions. And then we also give antibiotics if there is a risk of infection and so on. So these things are available, and babies can have really good outcomes. I know of babies who were born at 24 weeks who are now doctors. So it's totally possible for the baby to develop normally and achieve really good outcomes. It's through your support. You have to be, first of all, mommy has to be healthy, mommy has to be happy, not stressed, not anxious. It is, yes, it is a high percentage that can go into preterm labor, although not many are aware of it. But still, if it's, so now this 20 to 37 is quite a big spectrum, right? So depending on the stage that you have the preterm labor or preterm delivery, the complications vary. So if it is a late one, mostly it is to do with the lung. But as time, it's sooner, right? Then you can have the other systems also, like the brain and the lung and the digestive system all involved. But now, with the practice and with all the facilities, we know how to take care of these babies. So make sure you have access to a hospital with these facilities. You can research this. If you know, okay, you have had these risk factors, so okay, you can discuss with your practitioner. Is it best we choose this hospital because they have very good NICU or PBU facilities, because there is a risk. And then during the time of this delivery, or because we always try to prolong it as much as possible, right? If you go into preterm labor, if we can stop it, we definitely stop it and try to prolong it depending on the stage. So don't worry, but talk to someone about it. that it will ease your anxiety. And what you should know is that even if something does happen, there it is still possible for those babies to develop normally and achieve really good outcomes with the support we are giving. Yes, there are instances when babies don't make it, unfortunately, but we are still hoping for the best and trying our best to give them the best possible outcomes.
Every try is worth trying, isn't it? So every life saved, it matters. And like you said, the medical advancement is such that now expectant mothers don't have to be worried about it. There's no need to be anxious about it. All they need to be is to be aware of what the signs are. And as soon as they can get to an hospital, they know that help is readily available at hand. But tell me, Dr. Shani, nobody really prepares a preterm baby's mom to know what to expect in a NICU. What do you think that a mother should know in case she has had a preterm birth?
So, thing is, our babies are not going to be like the babies who are born term, because these babies are supposed to be inside our tummies. They are still not ready for the outside world. So they might have problems that the other babies don't have. They may weigh less, so with their birth weight might be lower. Then they have difficulties breathing, their heart. There can be certain different things about it because it's not fully developed yet, or the ducts didn't close yet. And so problems can be there, like they're susceptible to infection, they don't have proper reflexes yet, so they don't feed as well as other babies. And even for you yourself as a mummy, so stressed, might go into postpartum depression, might not produce enough milk. Anyway, you will be producing like less milk on day one and day two, and they will keep asking you to express milk, because if the baby is in the NICU, if the baby is incubator, they want you to express milk so that they do give the baby to suck. They And it is very important that you have mom and baby skin to skin time, which we call kangaroo mother care. We put the baby in and give that warmer, so that it helps with the bonding, with the warmth and the nutrition. It helps so many things. Kangaroo mother care is a must do, especially not just for preterm babies, term babies as well, but especially for preterm babies. And it's okay, when they ask you, okay, express mommy, express, I need so much milk. If you are not getting so much milk, don't stress. It'll come, baby, and you will find your own rhythm to breastfeed. Sometimes for preterm babies, just breastfeeding is not enough because they don't have that ability to suck. So you will have to cup feed, and it's always better to like feed them using a cup at the first few times, because then these face muscles, they tend to grow more and mature more that way. So these little things like keep the baby warm, play soft music, sing lullabies to the baby, and make sure the lights are dim, because preterm babies have problems with vision. So no bright lights. These things are actually done in the NICU. They cover the incubators. They are very strict about cleanliness, and so they monitor the baby all the time to see if any of these issues. So
I remember having all these apprehensions when I went into an ICU with my baby, and I knew that the sounds of monitors and machines that was making me nervous, and not being able to have the baby all the time was not something that I liked. Although I knew that it was for a reason that the baby is in an ICU, there were times when I was feeling really bad for not being there for the baby. And like you said, I wasn't able to express milk the first day. I was really depressed about it. And nobody told me that it was okay to not have any milk on the first day, because this was at 35 weeks. And I was, even though I knew so much about it, I had read about it, I was feeling so miserable. So is it okay to be in that state, and to feel vulnerable, to feel stressed, to feel that you're not going to be there for the baby, but you also know at the same time that there is help at hand, there are nurses, there are doctors, they are going to formula feed the baby if there is a need, but somehow as a new mom you end up feeling that you haven't done enough.
yes, definitely. As a new mom, that is like one of the major concerns we all have. You break down crying. Yeah, and I feel like it's okay. There are so many people there around us who will be ready to give us advice. Do this, do that. This is how things are done. But all I'm going to say to all those new mummies, take your own time. It's okay to feel vulnerable. It's okay to, you know, burst out crying if you feel like it. But always tell someone about it. If you feel like you need to get help, like if your postpartum blues are progressing to postpartum depression, talk to somebody, get that help. It's okay, it's normal to feel that way, but make sure you get that help, because getting that help will help you and it will help the baby. Because only if mommy is healthy, baby is healthy. Only if you're feeling okay, you can, your milk production will, because we can help you, we can give you certain medication to help with the milk production. We can, there are certain massages you do, the certain diet that can help with the milk production. So all these will be told to you, taught to you, right? Because with, in the NIC or the PBU, babies are always monitored. They are going to do their best to take care of your baby. And just like that, when the baby comes, and even when you're out of the NICU, you should take care of yourself so that you are able to take care of the baby when you get the baby at the NICU and after that.
And it's really nice that you tell that uh, everything can be available if you talk to someone, right? Most of the time we refrain ourselves from talking about it, either because we are scared of what the outcome is going to be, or we have the fear of being judged by people who are around us, or that we just not up to it, we just don't feel like sharing it with somebody because we've never shared these intimate personal things with anybody. So it's I really understand when you say that talk about it, and that's exactly what I want to stress on. And I really appreciate that you said this, the most important takeaway of today's interview is going to be to talk. Whatever you are facing, whatever you're feeling, however silly it might seem, it's important to talk about it. And now that we are on terms like we can make huge differences on social media platforms, do you think that government, the healthcare sector, or the policy makers can do something to bring about awareness about preterm deliveries and births?
Definitely helping when it comes to like educating mothers during like the antenatal period. There is so much information. There are so many workshops and antenatal clinics and antenatal lectures that are readily available for mothers. And then we say, oh, the attendance is low or no one shows up. Why? Because they don't seem to understand that it is important. Because it's what we should also understand is we should not just tell the mother, okay, during the first session, this is what is going to happen. It should be a little bit more, I feel like, personal. So where you can actually have these peer support groups where you can actually speak to each other and speak to your medical professional as a group. Oh, yes, I have this problem. Oh, yes, I have this problem too. And then I, as a health professional, am in a place to say it's okay. It's something normal. But if this happens, you have to be worried. Then come. And this should happen, I think, everywhere around the world, i- regardless of the stage of your pregnancy. There are things that women don't want to go and ask your doctor. And there are things that our society has just made that women, okay, you're a woman, you need to deal with this because, yeah, you're strong enough to have a baby. No, us, me, despite being a medical professional, I found it so difficult postpartum. And this is someone who actually works with as somebody who works with mummies, works with babies, somebody who has given advice on breastfeeding babies. To not be able to breastfeed my own baby
Yeah.
is, and subsequently to any of my friends or patients who were going through it, I what I always told was, take your time, your baby, and you will find your own rhythm, and it's okay. It's okay, but talk about it, voice out your worries, and that support has to be given to mothers. And I think policies, sometimes there are programs and people are not aware about it. I think that is what we should be doing, like sharing, okay, these are the things available to you, go for this, do it.
Like you said, we don't share a lot of things as women. Do you think that you mentioned earlier also that UTI could be a reason you could have a preterm labor, or could it be a vaginal infection that could lead to it? So these are the things that women don't normally see a doctor about. If they have a vaginal infection, they're really shy to go talk to their doctors about it. And especially if they're pregnant and if they're having any UTIs or STIs, it's important that they talk to their doctor about it. And I don't know how to tell people to come out and talk, see a doctor. Is there anything that you would like to tell about this?
All I would say is it's okay. Or I tell all my patients this, I tell all my friends, I tell my family, it's okay to feel vulnerable, scared, angry, sad. Just talk. Talk to someone you feel comfortable with. And it is actually one of the things that I am um, doing now, and I am planning to hopefully expand in the near future, is to create these support groups for these mothers where they where and sort of safe environment is created for them to speak. Hopefully these support groups work out and I will keep you updated.
That's really nice to know, and I look forward to it. If you were given a chance to make some policy changes in WHO or the UN, what would be your first change? What would you do to bring about awareness?
The first thing I think is, regardless of the where the mother comes from, where what their education background is, to tell them, okay, during your first visit, this is what can happen. Having a baby is all about this. I think one of the other things that they don't push is postpartum contraception, which I think is a huge topic, and we don't really have policies around. And a lot of problems that I see with not just the spacing between pregnancies, but the other risk that can happen because of the time periods short in between pregnancies, the nutrition for the baby, then the own stress and the difficulty the mother faces. I think these policies should be brought up, and people should actually talk about the risk, like the uterine ruptures, the placental abruptions. Mothers don't know about these, and we should talk about this. Mothers can, during these or these policies where we support them not as like patients, where we support them as humans, who need just a space to be comfortable, to share their thoughts, to have someone listen and understand. I don't know how we are going to go about it, but if WHO, if UN really want, that we talk about sustainable development and people and communities and poverty and health and wellness. I think taking care of mothers, pregnant mothers especially, is a start of taking care of a society, taking care of the community. It starts there. We are nurturing a new generation.
Yeah.
So our policies have to be made around making them secure, making them feel safe, and making sure that everyone can afford these facilities and these services equally all over the globe.
Absolutely, very noble thoughts, Dr. Shahani, and I agree with what you have to say. Let's put this thought in the universe, and let's hope that more people manifest it, more people support it, and like you said, awareness is the starting point. Once we are making people understand why is it that we are spending time talking about this, I think more and more people are likely to understand the need to talk about things like this, and especially sensitive things like this. And like you said, this is just the start. Having a baby in the womb is just the start of the another new generation. So, what better time than this to provide nurturing and support? Having said that, I think we've reached towards the end of this session, and I would really like to thank you for being with us today, for sharing your journey with us, for sharing your valuable insights, for all those risk factors that you mentioned for people to be aware of. I hope that people don't suffer in silence. I hope people can come out of their hole, talk about it, even if it means that they have had multiple miscarriages or preterm births. I hope they come out and say that it's okay and they're going to get better over time. And let's hope that it's a blessed beginning for all of those people as well.